Hello and welcome to the Ask Dr. Pane segment, where we take your questions and give our best assessment of what we can do, what we would advise in specific situations. In this case, this woman is in her early 40s and has a deflated abdomen with some loose skin, but it's not hanging down very much. And they want to know whether they would be better off having what they call a beltectomy or a circumferential abdominoplasty or a tummy tuck. And the other part of the question was they were concerned because if they get a belt procedure where the incision goes around the back, they feel that their backside is so heavy it's going to pull the incision open. So my thoughts on that are, when I looked at the pictures, this person does not have a lot of looseness in the back. Usually the circumferential tummy tuck or the beltectomy is something we do when people have lost a lot of weight. And the loose skin is not just in the front on the abdomen, but it's on the sides and back. So in those cases, those people are going to benefit from the scar. Most of the time, an extended abdominoplasty is going to be enough, which takes the scar around the side and almost onto the back, but not all the way across. When you connect the scar in the back, above the buttock crease there, it's okay to do that when it needs to be done, but I think some people do this more than it really needs to happen, and then you end up with a permanent scar in the back. That scar can get wide, so it's best left for people that really need it, and in this case, I don't think it would be appropriate for this lady. That being said, I have never had a patient have the incision back there separate because the buttocks are too heavy or large. That's a little strange. I suppose it could happen, but I've never seen it happen. Heavy stitches are used if this is done properly, and the layer is secured very nicely so that the weight of the buttock should not be able to pull that apart. In surgery, everything happens, if you look long enough, but I'm sure somebody's had it happen, but I've never seen that happen. So if the person wants the backside enhanced, which is kind of a side detour in this question, I usually would recommend doing a liposuction fat transfer first, and then you come back and do the tummy tuck later. Sometimes people that primarily want the backside done first will find that this procedure will give them the enhancement they're looking for, and if their abdominal skin shrinks down well enough, they may not end up with an abdominoplasty at all. So that's something to think about there. And we will talk to you next time.